So mental health wise, summary is that neurodivergence is a neutral brain variation. Challenges frequently arise from environmental demands and mismatches between the environment or expectations. Mental health conditions include substance use and behavioral issues. And what I've seen in my practice, as well as in my life, is that substance use, and I know several of you are substance use clinicians. So there's some slides further on about this. But substance use is frequently used not just as a way to cope with trauma. And those of you who are in the substance use profession know that trauma, PTSD frequently comes in hand in hand with substance use. But neurodivergence, there's a difference in how you process sensory information, so touch, sound, taste, and how you process information in general. So frequently, neurodivergent kids, adults will be using substances to help them manage overwhelm with sensory environments, overwhelm with information, social anxiety because they're in settings that they don't understand, or where they are just feeling completely disconnected from what's happening or out of sync with what's happening. They'll be using substances to manage all sorts of things, where if it's not a substance use that they're using to try and adapt to neurodivergence, it's a behavioral thing they're using to try and adapt. So sometimes that's video games to help slow their minds down, as weird as that sounds, or it's gambling, or it's shopping, or it's TV. But there is almost always some sort of behavioral thing that a neurodivergent individual is doing at a problematic level somewhere in their life. Legal social difficulties often do also occur, and we'll talk about stats in a minute, from a mismatch, and that's something we'll also talk about. So a goal in working with the neurodivergent folks as a professional or as a personal person in your life is to shift from fixing people and focusing on what's broken to shifting to creating supportive environments. Because with proper supports and accommodations, and this word accommodation really just means flexibility. We've created this loaded word accommodation, but really it just means flexibility. So with proper supports and flexibility, many comorbid conditions may not actually even develop.